Pregnancy is a time of incredible change. And while you're focusing on nutrition and rest, there's one area that deserves special attention: medications and substances that can harm your developing baby, also known as teratogens. Hi, and welcome to Clarivive MedInsight, where we make women's health easy to understand. Today, we'll break down what teratology is, which drugs and exposures are dangerous, safe versus unsafe medications during pregnancy, and how to protect yourself and your baby. Let's get started. What is teratology? Teratology is the study of how certain exposures during pregnancy can cause birth defects, developmental delays, or miscarriage. A teratogen is anything that can disrupt fetal development. That includes prescription or over-the-counter drugs, recreational drugs and alcohol, environmental exposures like radiation or chemicals, certain infections, even some herbal or natural remedies. The first 8 to 12 weeks of pregnancy, the first trimester, is the most sensitive period as major organs are forming. Common teratogenic drugs to avoid. Not all medications are dangerous, but some are strongly linked to fetal harm. 1. Isotretinoin, Accutane, used for acne, causes severe birth defects, must be stopped before pregnancy. 2. Thalidomide, once used for morning sickness, known for causing limb deformities, rarely used today, but a historical warning. 3. ACE inhibitors and ARBs, used for high blood pressure, can affect kidney development in the fetus. 4. Valproic acid, for seizures or mood disorders, increases risk of neural tube defects. 5. Methotrexate, used in autoimmune diseases, extremely harmful to developing tissue. Important: never stop a prescribed medication suddenly. Always speak with your doctor first. Illegal or recreational drugs or substances like cocaine, heroin, methamphetamine, marijuana, especially high doses or synthetic forms. These can increase the risk of premature birth, low birth weight, neonatal abstinence syndrome, withdrawal after birth, behavioral and developmental problems later in life. Even alcohol and nicotine, often underestimated, are dangerous. Alcohol, fetal alcohol spectrum disorders, nicotine, low birth weight, placenta problems, and here is the best part: many medications are safe or low risk during pregnancy. Some examples: 1. Prenatal vitamins with folic acid. 2. Acetaminophen paracetamol for pain. 3. Certain antibiotics like amoxicillin or erythromycin. 4. Insulin for diabetes management. 5. Low-dose aspirin when prescribed. 6. Antihistamines like diphenhydramine, Benadryl. Always confirm with your OB/GYN before starting or stopping any medication, even over-the-counter ones. How to stay safe during pregnancy. 1. Make a list of all medications and supplements you take. 2. Share it with your doctor at your first prenatal visit. 3. Avoid self-medicating or internet remedies. 5. Always check drug labels and pregnancy warnings. There are pregnancy safety categories like A, B, C, D, and X, but some are outdated, so rely on expert guidance, not just on Dr. Google or consultant ChatGPT. Many cases of birth defects linked to teratogens were accidental or due to misinformation. That's why education matters. You don't have to memorize every drug, just know when to ask. Pregnancy is a time of protection and preparation, and knowing what to avoid is a major step toward a healthy baby. Last, if you're planning a pregnancy or already expecting, always consult your healthcare provider before taking a single medicine, even herbal one. Stay informed and ask questions if you have. If you find this useful, then like, comment, and subscribe to Clarivive MedInsight for clear, reliable health education you can trust. In our next video, we'll talk about vaccinations, immunizations during pregnancy, what to take, when, and why it matters most. Don't miss it. See you tomorrow. Thanks for watching.